accuracy and efficiency in clinical practice and improve patient-centered outcomes. Artificial intelligence can potentially revolutionize various aspects of medicine, including surgery. It can provide valuable insights and assistance to medical professionals in making more accurate diagnosis, formulating optimal treatment plans, and even predicting patient outcomes by employing advanced machine learning algorithms. It is crucial to explore the potential integration of artificial intelligence advancements in the field of oncoplastic breast surgery. So, this is a diagram. Just have a look at it, and I will explain what it is all about. Uh, Artificial intelligence can be divided into broad artificial intelligence and the narrow artificial intelligence. In the broad artificial intelligence, we can do scheduling of the appointments, we can invite coordination among the health professionals, the dose regulation, imaging positioning, and quality assurance. They can all be done. Whereas in the narrow field of artificial intelligence, detection, diagnosis, triage, segmentation, treatment response prediction, and risk prediction, they all can be covered. So, uh, as I've already said, that the narrow AI is designed to perform a specific task under a limited set of constraints, whereas the broad AI learns and applies knowledge across a wide range of tasks at a level equivalent to or beyond that of humans. In healthcare, general artificial intelligence is equal to any intellectual task that a human doctor can perform. Now you can see that in the domain of artificial intelligence, machine learning is a subset that utilizes algorithm tools to discern patterns within data sets and make future predictions without requiring explicit programming. The integration into surgery begins in the early 21st century, and it has a profound impact in the developments of planning, navigation, and analysis of surgical procedures. Modern improvements and data analytics allow artificial intelligence to expand its efficiency and applicability to medicine and healthcare. The deep learning is another subset of machine learning that mimics human learning by utilizing artificial neural networks. Now, you have to understand that artificial neural networks are like neurons or nodes that process information like a human brain, and each node has interconnected links with specific weights and thresholds. When a node's output surpasses a defined threshold, it is activated, transmitting data to the network's subsequent layer. If it falls short, no data progression occurs. So you have to understand that a certain threshold of data, amount of data is required to activate the node. Otherwise, the system is not activated. And artificial neural networks represents the leading edge of AI technology in surgery and has a potential role in many aspects of healthcare, from identifying complex patterns in data sets to making predictions about disease progression. Basically, our deep learning, that is the next concept I'm going to tell, depends on the artificial neural networks. Okay, so I will start with the diagnostic parts. The primary function of AI in breast cancer screening currently everywhere involves the breast imaging reporting and data system, BIREDS. We are all familiar with the BIREDS system. Previously, it was done by the radiologist, and two radiologists were involved at all reputable, respectable setups. But now AI is playing its role to improve the disease detection and treatment outcomes. This is one of the trial by Humayun et al., and they said that the radiologist and the radiology residents, the AI was able to outperform the reporting done by the radiologist and the radiology residents. So there are other systems which are coming up, like this AI breast cancer screening by the Google's DeepMind. Google has its own AI system, and which is called Google's DeepMind, And they also, did a study on the mammographic reports, and what they came up with was that the breast cancer detection has a higher number of false positives. AI, on the other hand, isn't having as many issues with false positives. The results were from US and the UK. The false positives were reduced by 5.7%, and false negatives were reduced by 9.4% in the US. In the UK, the numbers were much different, with 1.2% and 2.7% reduction in the false positives and false negative rates when they used the AI instead of the traditional radiologist doing the reportings. The AI in question only had access to the most recent mammogram of each patient, but it was able to make screening decisions with higher accuracy than their human counterparts. This is another study. There are different studies. I think I should just mention, explain it to you, because it is not going to, you will not be able to remember all these studies which were done on the breast screening, mammography and ultrasound for the detection or better detection of the breast cancers. This is another study which was done at the New York University breast ultrasound data set, and again they were able to prove that the accuracy, consistency, and efficiency of breast ultrasound diagnosis was improved. Still, they concluded that AI is not a replacement for the expertise of clinicians, but the powerful complementary role of artificial intelligence systems as a decision support tool should be increasingly translated into the clinical practice. And then there is another thing called radiomics. Radiomics is an approach to medical imaging that relies on artificial intelligence to analyze quantitative information extracted from images. Here, what they're doing is that they extract the features that reflect activities that occur at the genetic and the molecular levels. Radiomics is classified as supervised or unsupervised. Supervised starts with training AI using pre-existing data archives, and in unsupervised machine learning, information without reference to pre-existing data or data derived from the image itself is used by the machine. And the deep learning models recognize and classify images by autonomously reducing each to a set of numeric features that are processed using a multi-layer neural network. There's another study which concluded that there is a significant case control classification performance in success by linking the identified features to the breast cancer. This was achieved by training and testing the model on contralateral mammographic images from two distinct databases. Basically, what they are doing is they are preparing models, and they are taking data, and they are comparing, and artificial intelligence is able to better report the mammography films images. um, in another study, AI was effectively able to differentiate between high risk groups and healthy controls by applying a pre trained Alex net model to mammographic images. And then in another study, uh, there was a harnessed convolutional neural network to merge parenchymal complexity measurements into distinct meta features for risk prediction. The method outperformed conventional parenchymal pattern analysis, further underscoring the potential of such groundbreaking techniques to enhance breast cancer risk prediction. So, cancer risk prediction is again better predicted by using AI models other than the traditional parenchymal complexity measurements. These studies present early evidence that full field digital mammography based deep learning models may prove more accurate than traditional density based and epidemiology based models in predicting breast cancer risk. In 2019, Becker and al. Performed a retrospective study using neural network image analysis software for mammographic diagnostics. The model was tested on two datasets and demonstrated comparable performances with radiologists, but with better sensitivity. These are all different studies, and again, they are able to prove that the use of AI can significantly reduce the physician workload, and whereas they also have a good future role in breast reconstruction procedures. So, breast oncoplastic and reconstruction is an essential element in the multidisciplinary management of today's world, as they aim to restore patient body image and post mastectomy quality of life. AI technologies show promise with respect to impacting surgical disciplines like breast reconstruction, pre, intra, and post operatively by assisting otherwise subjective interpretations and decision making, which risk inconsistencies in surgical outcomes and long term complications. So the potential applications of AI with breast surgery are extensive, and surgeons should stay abreast of developments. Although we are not applying in our setups, but we should all be very much familiar as the knowledge and technology are increasing all the time, and we'll soon be dependent on such latest advances. In breast reconstruction, narrow AI systems can be utilized in analyzing mammograms, ultrasounds, and MRI images to identify potential anomalies, and AI algorithms can optimize personalized surgical techniques and help predict patient specific outcomes. Broad AI can assist in the integration of data from genetics, radiology, pathology, and clinical history to create a comprehensive patient profile, to formulate personalized treatment plans, predict the potential complications, and ensure quality assurance. A review of how AI specifically impacts breast surgery and reconstruction via the critical assessment of existing research is still in pipeline. So AI also enhances surgical simulations by integrating with radiographic imaging to create accurate 3D models, streamlining preoperative planning and intraoperative navigation, and might contribute to report assisted surgery as well. AI's role in selecting the reconstruction type and predicting the aesthetic results of different techniques further assist decision making. AI's post operative contributions include predicting potential complications and enabling more accurate surgical outcome evaluations. Preoperatively, now we'll have a brief look on the preoperative, intraoperative, and postoperative role of the AI. Some possible areas of exploration: preoperative planning, uh, where the algorithms can be used to analyze the patient specific anatomical data to predict optimal surgical approaches and individualized reconstructive techniques. Once a breast lesion is detected, can the surgeons can pre-operatively plan by adding the breast volume, shape, and symmetry to make a better decision. Preoperative imaging studies are essential for assessing the vascular supply of the breast and can determine the reliability of reconstructive techniques. As you all said, saw in the earlier presentation that different flaps were rotated, so the vascular supply is very important to keep those flaps alive, and AI can immensely help with that. Specific machine learning technologies like the faster RCNN and Inception BreastNet V2 deep learning framework for ultrasound breast images have further optimized these processes and show potential for use in surgical interventions. These are all the AI models which people are working on to help with these surgical interventions. Research highlighting the benefits of AI support in the preoperative period of breast reconstruction has been performed, and the feasibility of using computer software to support preoperative planning for microsurgical reconstruction using the DF flap technique was done in 2020 by Mavioso et al. And the researchers developed a convolutional neural network to identify perforators and tested the software on 40 patients, and they were able to detect the key perforators in almost 97.7% of the cases, and they supported the use of machine learning techniques to improve the preoperative planning for the breast reconstruction. AI can also be used to simulate results during the preoperative period of breast surgery and for better cosmetic outcome. There's another study where they evaluated a neural network in 2022 after training itself on real clinical images, and was able to consistently generate preoperative images that were comparable to real surgical results. Now there's also role of intraoperative use of AI, because when you are extracting the tumor, you should be very sure that all of the tumor is gone in one setting. Within the confines of operating theatre, AI has the potential to support surgeons in real-time decision making and enhance surgical precision. Uh, in endoscopic surgeries, computer vision algorithms can scrutinize intraoperative imagery and highlight in crucial anatomical structures to offer guidelines for meticulous dissection and implant placement. The role of AI-assisted robotics for surgical intervention on deformable breast tissue is also there's no research at the moment, but in theory, research is, they are contemplating research on deformable breast tissue as well. This is important, which I would like all of you to remember that we do lumpectomies in breast conservation surgeries for the cancer patients, but about 1 in 4 breast conservation surgeries end up having a need for further resection of the positive tumor margins. So that is quite problematic for the patient to go, have another surgery. In such cases, the AI can provide a better solution for good, effective, and user-friendly, experience. This is an ongoing study in the US, the Perimeter OCT imaging platform, Atlas AI project. What is happening is Perimeter is conducting a randomized controlled trial to develop the next generation of perimeters commercially available, and it is a powerful intraoperative tool for identifying regions of interest to help surgeons make real-time decisions on margin status in the OR. Goal is to determine whether this technology can help lower re-excision rates, potentially setting a new standard for specimen imaging technology during breast conservation surgery. In this diagram, you are able to see that this is the machine, and after removing the specimen, it is placed in this immobilization system, tissue immobilization system, and then the broad-based tissue library is already there in the machine. The algorithm and the AI is analyzing it, and then they are able to give an answer right there while the patient is operating. Provide look here guidance to speed up image review. In the end, you can see that the perimeter is, image assist technology. They are able to tell during the surgery to the surgeon whether there's a need of re-excision of the margins intraoperatively. Surgeons performing a lumpectomy are able to scan tumors using the console, and this intelligent system is then able to accurately detect the margins of the tumor, allowing surgeons to preserve as much healthy tissue as possible while removing all of the cancer cells. The more images of tumors that this algorithm can learn from, the more accurate it will become at detecting tumor tissue in real time during surgery. You, okay. Um, Then there are post-operative use of artificial intelligence as well. Early detection of complication or recurrences is possible. Timely interventions can be done. Patient care is improved. Pain management can also be, help with this, and post-operative evaluation of symmetry. Clinical monitoring and evaluation can detect symptoms of infection, hematoma, or mispositioned implants. Timely intervention and timely intervention can lead to less likelihood of enduring complications. In a study in 2021, validated the ability of machine learning models and identified factors that predict breast reconstruction complications in 568 cases. And Mayung et al. Found that the AI technologies could be effectively used for assessing the risk of negative patient outcomes in reconstructive surgeries. In another study, uh, by Nair et al. In 2022, they were able to predict post-operative opioid requirements in patients undergoing ambulatory surgery, thus optimizing post-operative care. These systems offer significant improvements over conventional methods such as clinician-controlled questionnaires, and provide advantages within a healthcare system where time and human resources are often constrained. By improving the efficiency and quality of post-op pain assessments and prediction models, it has the potential to prevent debilitating post-mastectomy pain syndromes in patients who undergo breast surgery. ML models can identify predictors for neuropathic pain in patients who have undergone breast surgery better than the traditional models. Um, Breast symmetry evaluation is another very important post-op outcome of breast conservation surgery. And in a study by Canning et al., they used 200 frontal photographs of patients who underwent breast surgery and tested a neural network on 47 frontal images of patients who underwent breast reconstruction after breast surgery. The neural network was successful at localizing key breast features, including breast boundaries and nipple areola complex in 97.7% of the cases, with an impressive mean detection time of 0.52 seconds. By automating the detection of key breast features, AI could revolutionize the evaluation of breast symmetry post reconstruction. So the future goals. The future goals. These are the goals which are defined by the West after all the studies that I've explained to you. Although I think there were a lot. So the future research agenda comprises data set standardization and AI algorithm refinements, implementation of prospective clinical trials, and fostering of cross-disciplinary participations, the fusion of AI with other emergent technologies like augmented reality and 3D printing, as they can further propel progress in the breast surgery. Okay, so what we should be able to grasp from today's presentation is that with the integration of artificial intelligence into healthcare, there is great potential for improving diagnostic accuracy and personalized treatment. However, collaboration and ethical frameworks must be established, regardless of issues related to ethics and implementation. With the advancement of artificial intelligence, the intersection of technology and healthcare foreshadow a future in which artificial intelligence will elevate the standard of care, creating a paradigm shift in the healthcare. Thank you.
Thank you so much, Dr. Arifa and students. This is a very future insight and the future deep machine learning and the AI and strategies. And this is a wonderful presentation. The future belongs to this, that the AI is going to be in the screening, in the radiology, in the predicting models,